Take two.
Irregular periods, stubborn acne, unexpected facial hair. Could it be PCOS? Let's break it down. Hi guys, I'm Rose and welcome to Period, the show where we talk women's health with no shame, no whispers, just the facts. Today, we're talking about PCOS, what it is, the signs to look out for, and what you need to do about it. Let's get into it. So, what is PCOS? PCOS stands for Polycystic Ovarian Syndrome. Let's simplify it. Polycystic means many cysts. Ovarian in the ovary, and syndrome, a group of symptoms. So basically, many cysts in the ovaries with other symptoms. These symptoms can include acne, sometimes severe, excess facial or body hair, irregular periods, weight gain, or difficulty losing weight. Doctors don't diagnose PCOS based on one thing. They look out for two of the three key features. Number one, polycystic ovaries on the ultrasound, often described as a string of pearls. Number two, raised androgen levels. These are male hormones that women have in small amounts. When they're high, you may see severe acne, excess facial hair, or increased body hair. Number three, irregular periods, usually fewer than 9 periods a year or cycles longer than 35 days. This often means ovulation is not happening regularly. And just to be clear, PCOS is not the same thing as having ovarian cysts. So how does it show up? Many women discover PCOS because of irregular periods. Others find out when they're trying to get pregnant and it's taking longer than expected. So PCOS doesn't always show up the same way. And that's why treatment is not one size fits all. Now, treatment and what matters most. Treatment depends on your symptoms and your goals, but there are two key principles every woman with PCOS should know. First, you need to have at least one period every 3 to 4 months. Why? Because when periods don't happen, the lining of the womb keeps building up. Over time, those cells can become abnormal, a condition called endometrial hyperplasia. So if you haven't had a period in up to 3 months, you need to speak to your doctor. And just to be clear, this does not apply to women whose periods are controlled by certain contraceptives. Second, weight management. Not weight loss, weight management, because not everyone with PCOS is overweight. But PCOS increases the risk due to something called insulin resistance. So what helps? Regular physical activity, walking, climbing stairs, exercising, a balanced diet. And if you're overweight, losing just 5 to 10% of your body weight can make a big difference. Also, PCOS increases the risk of diabetes, so regular screening is important. Now, symptom-based treatment. Treatment is tailored to your symptoms. Excess hair, hair removal methods. Acne, standard acne treatments. Irregular periods, sometimes hormonal medication. And yes, some doctors may prescribe contraceptive pills, not just for birth control, but for benefits like regulating periods, reducing acne, controlling excess hair. And for women trying to get pregnant, doctors may use medication or other treatments to help with ovulation. So you see, PCOS is common and it's manageable. The key is understanding your body, treating your symptoms, and getting the right support. If you have PCOS, you're not alone and you have options. Got questions? Drop them below or send them anonymously. And remember, no shame, just facts, period.